Hi everyone, my name is Alicia, and for the SR1 paper, I chose to talk about the Jordan Principle, its historical context, as well as a critical analysis of its implementation. So my script is actually just up at the top corner of the screen, so I will be looking occasionally in this direction and then looking back at the screen just to let you know. Okay, so Canada is seen as a country that promotes multiculturalism and equality amongst its citizens, and that's regardless of your race, your ethnic background, your religion, or any other identification markers. And that's partly because we do have policies and legislation that really try to combat systemic and institutional discrimination of members in our society that are the most marginalized. So, as Canadians, we do take a strong stance against oppression, but that doesn't mean that it's completely eliminated or even properly addressing the inequalities that the policy is even trying to fix. So, when this belief is adopted, Canadians fail to acknowledge the years of discriminative laws, legislation, and policies that were implemented in the name of fairness, but in actuality don't really serve that purpose at all. And a good example of such legislation would be the Indian Act. It's a good example. It's a type of legislation that's built upon racist and discriminative frameworks and judgments regarding First Nations people. So because the Indian Act tries to control and give procedure to many topics that pertain to like First Nations people, I will only be focusing on the child welfare aspect of the Act, specifically the Jordan Principle, which aims to ensure accessible healthcare to children who live on the reserve. So I'll talk about the Jordan Principle now. So Jordan's Principle was created as a response to the unequal treatment of First Nations children living on a reserve who are trying to access healthcare. So my paper looked at the federal government's response to the principle. It then discussed the historical context of the principle, followed by the critical analysis of how the government's response impacted Aboriginal people. So Jordan's Principle was named in honor of Jordan, who was a First Nations child who was transferred to a Winnipeg hospital in 2005. And so what happened was the federal and provincial government spent 2 years trying to settle a dispute surrounding which governing body would basically be responsible for the home healthcare costs. And what ended up happening was Jordan was never discharged from the hospital because of that prolonged governmental disagreement. And ultimately and unfortunately, he died in the hospital. He was never even brought back to his family home. So as a result, Jordan's Principle was adopted as a child-first policy so that the needs of the child would first be met before any jurisdictional issues came into effect. And that would help to ensure that there would be no denial of service, delays, or disruptions that Jordan experienced because of the governmental jurisdictional conflicts of basically who would pay for the bill. So currently, through the Indian Act, services for First Nations children living on a reserve are funded by the federal government. They're regulated by the provincial, territorial legislation and standards, and they're provided by the provincial and territorial service systems. So that's why the principle was brought in, just to make it easier for kids to get the help that they needed and for the treatments to be equal to services that were provided to non-reserve kids, and just to bypass all the complexities that came with funding and service delivery systems. And those complexities were actually creating the barrier for accessible healthcare in the first place. So it's really important to keep in mind that the group that I'm talking about, children who are living on a reserve, they already have differential access to healthcare already, and that's because of their inherent characteristic of living on a reserve. In my experiences of living in a small town that was close to a reserve, these reserves were located on the outskirts of town, on land that no one really wanted, that was kind of discarded for First Nations communities to use, and are farther away from services that the broader community uses for adults and for children. So that's really important to keep in mind. As well as the procedure for getting healthcare is more complex, and jurisdictional conflicts come into play when that's something that non-reserve kids don't even have to think twice about. There's also just a general lack of funding for in-reserve services and facilities, especially for kids' parents who want culturally inclusive services for their children. So it's really important to recognize that already in our society there's that disparate treatment of certain groups, and it's really, really, really important for us to be careful not to carry those biases into policy and in the implementation or lack of implementation of the policy. So the principle on paper looks great. It's addressing unequal treatment of First Nations child healthcare accessibility. That's a really great thing to fight for. But as will be discussed later, unfortunately, it was the federal government's lack of response to the implementation of the policy that perpetuated and carried forward this judgment and bias that First Nations issues are going to be handled with a lack of care and inattention. So the Indian Act is a piece of colonial legislation that is fraught with racist ideologies and prejudices. The employment of this act tries to address a vast array of topics that Indigenous groups are specifically dealing with, which include the lack of accessibility of child health care, which was my focus of my paper. So when it was first enacted, the act had control over the governance, land, and just cultural practices of First Nations people, and they were honestly just trying to assimilate First Nations people into Euro-Canadian culture and completely eradicate their culture, practices, and beliefs. So such a racist governing practice has definitely ceased, with more of a focus on collaboration with Indigenous groups and being more culturally sensitive towards their values and their customs. But now there's a more covert discrimination that exists, and there still continues to be that deep-rooted assumptions and judgment. So when policies pass, those biases unfortunately follow with it. So a discussion of the Indian Act is important to further discuss the Jordan Principle, because such a principle is completely entrenched in historical biases and judgments that give a justification, and it creates this societal commonplace to mistreat Aboriginal people. So what ended up happening was the principle, though on paper, helped address the injustices that were faced by the kids, but it was the federal government's response that actually made it discriminatory. So a complaint was filed in 2007 alleging the federal government erred in implementing the principle, and that its approach to First Nations child welfare programs were discriminatory on the basis of race and national ethnic origin. So fast forward to 2016, the Canadian Human Rights Tribunal actually affirmed this finding, so that's great. It's in the step in the right direction for sure. Then in 2019, a decision actually concluded that Canada willfully and recklessly discriminated against the children, and that Canada was to basically pay an amount to compensate the families and their children who were impacted by the system. And this is great. It's definitely a step in the right direction, because it's this public condemnation of the government government's lack of response to help these children. But unfortunately, the tribunal had to issue 10 orders to ensure Canada's compliance. And that's pretty saddening because it just illustrates that efforts are being made to address the systemic inequalities that our government is perpetuating, but you still hold these biases and judgments towards Indigenous groups because of this lack of action to fix the wrongdoings in a timely manner, and the fact that compliance was forced upon them rather than willfully addressed. So that's just something that it's very, it kind of creates a narrative in our society that it's okay to treat certain groups a certain way. So there is a clear lack of motivation for governing bodies to adopt the principle that would ensure that the jurisdictional disputes don't affect the quality and access to healthcare. And such an issue would not exist for kids who don't live on reserves because the services that they go through are different and they're not complex. They're easy to navigate. Furthermore, jurisdictional ambiguity definitely plays a role in the lack of access to healthcare. But then there are other social problems that are also playing a role, but they're not being addressed. So how does that eliminate the overall arching problem of lack of access? So what I mean by that is reserve kids, they also face issues of underfunding of programming as well as low quality services that, if they are available to the kids, they're lower quality compared to services that are given to non-reserved kids. So these issues are going to continue to exist because there's that lack of effort to actually address the entirety of the problem. And, you know, it's that hidden message that some children's lives are more of an investment than others. And that's very unfortunate to say. And if that bias didn't exist, then child welfare programming for all children in our country would have similar standards, would have similar practices and similar focus, so that all children would have opportunities that are equal. So in conclusion, the Jordan Principle was a way for all First Nations children to have access to child health care. However, in practice, the jurisdictional disputes created more barriers for the children to access the help that they needed. So this concludes my video presentation for the Jordan's Principle. I hope that it gave you some information and understanding of a current policy in our society that really does, on paper, try to address the injustices faced by these kids who live on a reserve, but in practice really don't do that. And that's based on a lack of response to implement the policy. So it's really important for the citizenry to critically evaluate such legislation and policies, and to really call out when our country is being oppressive towards marginalized people. So thank you so much.